Hi everyone, my name is Kiran. I'm a postdoc at Mass General Hospital and Harvard Medical School, and I'll be talking about the quantification of fibrinaloid clots in pediatric long COVID patients. I have no conflicts of interest. So after an acute infection, around 1 in 5 children will go on to develop ongoing symptoms. And these symptoms can last for months to years. So it takes several months to establish a diagnosis. And this happens because of it overlaps with many existing conditions, and because there's no established diagnostic test for long COVID yet. And so a new assay is needed, which can lead to faster diagnosis, monitoring, treatment, and response. And so we've heard from speakers today that there are many different hypotheses for why long COVID happens, and we're focusing on fibrinaloid clots or microclots. So these are very dense structures which are made of amyloid fibrin, which means they're very difficult to break down and can remain in circulation for a very long time. And so we developed a microfluidic assay using these microclots, which we hope can aid in the diagnosis of long COVID. And so if you come to my poster, I can talk more about the device characterization, so looking at how we looked at the distribution and the capture efficiency of these devices. We also studied the quantification in long COVID patients, and namely we looked at 2 different subgroups, spike positive and spike negative cohorts, where we found a much higher microclot burden in spike positive long COVID patients. And then we also tested the diagnostic capability of these devices using ROC curves, where we found specificities and sensitivities above 85%. So if you'd like to learn more, please come by poster 15. Thank you.